Era Mariesu to Hera Manadeung, Era Mariesu,
Era Mochuere,
Era Mariesu to Hera Manadeung, Era Mariesu
to Era Mochuere.
Myself, I'm using family planning. That is me and my wife. We are one thing.
Era Mariesu to Era Mochuere.
Zamani, wakati nilikuwa naenda kuchukua dawa za family planning, nilikuwa sipimwi juu ya HIV. Ndio ilikuwa inafanya mtoto wangu akafa kule nyuma.
For mothers who are HIV positive, used to conceive without knowing, and it was leading to deaths of these mothers.
My role was to find out and to talk to people if they can conceive the idea of taking family planning as an option, as well as keeping to their status. I realized when I was moving around the community that so many people were not having some information. There was a loophole. People were not really sticking to, and they were also not practicing family planning. To those who are HIV positive, we do encourage them to plan and then also to give birth.
Hawa wanawake ambao wanazaa siku hizi nawasaidia kuambia kuwa wajaribu kufanya family planning kwa sababu itawasaidia. Ukizaa na uko na virusi na unazaa kila mara, itarudisha immunity yako chini.
We also came up with a system of booking all patients who are on family planning on a diary. So every time they come, we know this client is on family planning and we put a sticker on the file.
And so you have a great opportunity that even as you offer the HIV services to be able to integrate family planning. It's more cost effective to pool the funds for family planning and for HIV and bring them together. After all, it's still the same client, and therefore reduce the unmet need among all these people.
If a patient comes, maybe they are here for HIV care, family planning, we all offer it at one place. It's just a one-stop shop.
And I can see that you are on implant, Jadel.
Yeah. The family planning I'm taking is I am using condom and Jadel. I put Jadel 2010. And from that time to this time, I don't have any problem with the Jadel. I'll remove after 5 years. That is where we decided with my husband. After that, we can have one kid. I have a peace and a very happy life with my family because I know very well the time I want to have another baby, 2016 on September.
So Lydia, I can see your CD4s are doing great.
Yeah.
You don't have any medical issues today.
Okay.
So I'm just going to give you the daily prescription of ARVs.
Come back after 2 months.
In the beginning, it looked like, wow, this is a real hard task. How can we be doing all things in one room because we were not used to? But I believe change comes slowly and change can be adopted the way, and then it becomes a routine now. Here is where we do all the basic services of HIV. There's HIV care, that is the comprehensive care. There is TB, HIV treatment here, yeah. And then also we have family planning integrated into a HIV clinic, which is done here.
Once it had kicked off and people had gotten the idea, then it was easy. We stopped going to visit them every 2 weeks. We started going once every 2 months because we were able to continue providing the services on their own. The DHMTs approached us and asked us to integrate even more sites. And so as much as we had the 12 study sites, in the 5 districts that we supported, we had nearly 40 sites that were providing fully integrated family planning and HIV services. And this was outside the project, it was outside the support of KEMRI and UCSF, it was an MOH-driven agenda, and I think that was very, encouraging. And clinics even went further and not only integrated family planning and HIV services, but even added outpatient services into the HIV services. That there is what we call the HIV appetite. Whether you're negative, whether you're positive, we are treating you all the same.
There was a lot of stigmatization about HIV/AIDS, but as time went by, people started coming and they were accepting. So now I was asking, do you think you can still have a child? And do you think you can consider disclosing this openly? And to a few that I talked to, I am happy they were able to come to the facility where I will get report. There was somebody here.
Strategies we've used integrating family planning and HIV. We do daily health talk to all patients who comes to the facility. All.
Ya kushoto, alafu inawekwa hapa. For 5 years. After 5 years, nitaona kama naweza chukua wakati nizae mtoto mmoja ama nifanye nini? Tena niongezee ingine.
Na tunasema it is a minor surgery.
His concern was, does vasectomy reduce the libido in men? And I've just advised that it does not reduce any libido in men. The man can still enjoy sex as usual and achieve ejaculation. The only difference is that in the ejaculation there are no sperms.
It was amazing to sit in the health talks and have these men ask questions, about family planning. We actually had a man, come to us and say, I want a vasectomy. And this man was polygamous, and he did the math. He figured that if his 2 wives have to keep on coming every 3 months for depot or every month for the pills, then it made sense for him, as the person who was able to pregnant these 2 women, to go for the family planning method. And he was not the only one.
I believe that due to the use of ARVs and family planning practice was led to the good outcome of the status of my baby. The baby is HIV negative. We used to blame one another or each other. Mother used to blame me, I used to blame mother. But when family planning integration started, we were told everything. I knew all the methods, myths and misconceptions which were being said. The love, the standard of the love will be raised between the spouses, between you and your wife, or between the wife and the husband.
One Stop Shop was developed to demonstrate family planning and HIV services integration, implemented by the Kenyan Ministries of Health, with support from Family AIDS Care and Education Services, FACES, a collaboration between the Kenya Medical Research Institute and University of California, San Francisco. As a result of this work and the work of other institutions, family planning integration is being scaled up throughout the country and in many regions.